Okay guys, now in this part 2 of the proximal convoluted tubule, we will be discussing about the values of renal threshold. Okay, what is the renal threshold value for glucose and what is the transport maximum and what are the glucose titration curves, that we will discuss now. Okay, see, first let me give you a basic understanding. Here there will be some calculation based questions also there, so be attentive. Guys, here I am showing you the glomerular capillary. Okay, here I am showing you the glomerular capillary. Down to the glomerular capillary, what do we have? We have the Bowman's capsule and the nephron. Okay, let's say for easy understanding purpose. Guys, first of all, what is the normal plasma glucose value? The normal plasma glucose value. The normal plasma glucose value in a normal individual, let's say, in a normal individual, it's 100 milligrams per deciliter. Deciliter means how many ml? 100 ml. Okay, deciliters means how many? 100 ml. So can I say something like this? In 100 ml, how much glucose is there? 100 milligrams of glucose is there. So in every ml, how much glucose will be present? In 100 ml, 100 milligrams. In 1 ml, there should be 1 milligram. Okay, there should be 1 milligram. So in every ml, there is 1 milligram of glucose. Fine. Now, how to calculate the filtered load of glucose? How much glucose is getting filtered every minute? How much glucose is getting filtered every minute? That is the filtered load of glucose. The formula is GFR into plasma glucose concentration. And you know what is the normal GFR value? 125. 125 into what is the plasma glucose concentration? 1 milligram in every ml. So tell me, what is the filtered load of glucose? The filtered load of glucose is 125 milligrams of glucose is getting filtered every minute. Okay, in a normal individual, how much glucose is getting filtered every minute? It's 125 milligrams of glucose is getting filtered every minute. Simple logic, no? 125 ml, there is 125 milligrams. In every ml, there is 1 milligram. In 125 ml, there will be 125 milligrams. So 125, this much amount of glucose is getting filtered into all the nephrons together every minute. Now, our nephrons are designed in such a way, this 125 is nothing for them. So all these 125 milligrams will be reabsorbed. 125 milligrams will be reabsorbed. So how much glucose is lost in the urine? Now, any glucose is lost in the urine? No, there is no glucose at all in the urine. So 0 milligram glucose lost. Done. But now, see what I am trying to say, all boys are not same. Okay, everyone is not same, right? In the same way, all the nephrons are also not same. They are having different capacities, different capabilities. So some nephrons in our kidney are weak nephrons, guys. Try to understand the concept. Some nephrons are weak nephrons. Normally, when 125 milligrams is filtering, okay, every molecule of glucose is getting reabsorbed. See, when your plasma glucose in normal range, how much is the plasma glucose now? 100 milligrams. Any glucose is seen in the urine? No glucose is seen in the urine. Not at all one molecule of glucose. But what is renal threshold value for glucose? See, if you are increasing the plasma glucose value to, now how much plasma glucose is there? Now when you increase the plasma glucose value to 200 milligrams per deciliter, means you are increasing 200 milligrams per 100 ml. So now more glucose is going to get filtered. Yes or no? Now more glucose is getting filtered every minute. More glucose is getting filtered. Now when more glucose is getting filtered, some nephrons, there will be some weak nephrons. What they will do? These weak nephrons, they will start to leak glucose into urine. So this value is called as renal threshold value for glucose. So now tell me, what is the renal threshold value for glucose? Is somewhere around 200, more than 200. So till 200 means, see, my plasma glucose right now, let's say 100. Any glucose coming out in the urine? No. Increase it to 110, nothing will come out. 120, nothing will come out. To 150, nothing will come out. Increase it to 200, still nothing will come out. But if you are increasing more than 200, okay, if you are going beyond 200, means any value greater than 200. Now, because of some weak nephrons, they will start to leak the glucose into the urine. Healthy nephrons, see, let's say 95% of the nephrons, 95% of the nephrons are trying to reabsorb. But because of some weak nephrons, glucose will start to appear in the urine. So now tell me, when for the first time glucose appeared in the urine? When your plasma glucose value goes beyond 200 milligrams per deciliter. That is called as the renal threshold value for glucose or urinary threshold value for the glucose. So that is what I am showing you here. So right, what is the renal threshold value for glucose? See, when the plasma glucose concentration, see the plasma glucose concentration at which glucose first begin to appear in the urine. This occurs before all the glucose transporters are saturated. See, till the healthy nephrons are still working, healthy nephrons are still trying to reabsorb, but some weak nephrons, see, due to the variability in the nephron function, all nephrons are not same. There is a variability in the function of the nephrons. There is something called as a nephronal heterogeneity. Different types of nephrons are there, different capabilities are there. Okay, so see, that's why the heterogeneity. Okay, now look, what is the typical value? The renal threshold value, typical value is around 200 milligrams per deciliter, usually about 200 milligrams per deciliter. What it is telling us? See, it reflects the point where some nephrons, not all the nephrons, some nephrons begin to excrete glucose, even though others are still reabsorbing efficiently. Okay, others are still reabsorbing. Whatever you are giving, others are reabsorbing, but some nephrons are weak. Done, sir. Done. Now, let's try to see what is transport maximum value for glucose. Transport maximum value for glucose. So, what is this transport maximum value? See, at the end of the day, glucose is getting reabsorbed or not? Yes, sir. How much glucose is getting reabsorbed every minute? What is the maximum capacity of the nephrons? How much maximum glucose can be reabsorbed? All the nephrons, the weak nephrons, the healthy nephrons, all of them. How much maximum glucose they can pull back? That is called as a transport maximum value for glucose. And how much they can reabsorb? Maximum 375 milligrams of glucose can be reabsorbed every minute. Okay, so now tell me, how much is the maximum capacity of the glucose reabsorption? You tell me one thing, guys. Nephrons are reabsorbing glucose or not? Yes, nephrons are reabsorbing the glucose, sir. They are reabsorbing the glucose. How much glucose can be maximally reabsorbed? Definitely there should be a value, no? How much is the maximum capacity? Healthy nephrons, weak nephrons, all of them, if you go and ask them, all nephrons, please tell me how much maximum glucose you have reabsorbed in a minute. They will say, our maximum capacity is 375. Of course, weak nephrons are leaking, but at the end of the day, the both healthy nephrons and weak nephrons, their maximum capacity is to reabsorb 375 milligrams every minute. Okay, so that is the transport maximum value. At the transport maximum, all the glucose transporters, all the SGLT2s are saturated. Beyond 375, they cannot reabsorb. They will say our maximum capacity is 375. Beyond that, they cannot reabsorb. Okay, beyond that, they cannot reabsorb. So, look at what is transport maximum value for glucose. Transport maximum value is the maximum rate at which glucose can be reabsorbed by the nephrons, beyond which the excess glucose will be excreted. Okay, after this, you cannot reabsorb any glucose. See, try to understand, guys. 375 is the maximum glucose that you can reabsorb. But some nephrons, they are leaking, of course. At 200 plasma glucose itself, some glucose is going. I am not asking about how much glucose is getting excreted. Weak nephrons, healthy nephrons, all nephrons together, how much maximum they can reabsorb? 375. Done. So, what is the normal transport maximum value for the glucose? Is 375 milligrams per minute. Okay. After 375, no reabsorption, no further reabsorption, because all the SGLT2 transporters are saturated. Okay, they are showing their full capacity. Done. Now, you might be thinking how question will come in your exam. Okay, how question will come in your exam? Let me tell you. Guys, let's say here I am talking about a patient. Okay, here I am talking about a patient. Now, in this patient, what is the plasma glucose concentration? The plasma glucose concentration in this particular person, let's say it is 400 milligrams per deciliter. So, definitely he is a diabetic patient, you know, lot of glucose is there. Now, what is his GFR? Let's say his GFR value is 125 ml per minute. Okay, like normal GFR. Now, his transport maximum value is 375 milligrams per minute. Normal transport maximum I am giving. Now, I am asking you how much glucose is excreted in the urine per minute. How much glucose is getting excreted? Now, you have to calculate and tell me. Now, think how to do such questions, how to solve such questions. Now, simple. Here will be the woman's capsule, right? Let's say here is a woman's capsule. Now, you tell me how to calculate the filtered load of glucose. Now, the formula to calculate, now first you have to calculate the filtered load of the glucose. The filtered load of glucose, how much? The formula is GFR into plasma glucose concentration. Now, you tell me how much is the plasma glucose concentration, 400 milligrams in deciliter. That is 4 milligrams per ml. Simple logic, no? Deciliter means how much? Deciliter is nothing but 100 ml. 100 ml. So in 100 ml, there is 400 milligrams. So can I say in every ml, there will be 4 milligrams. So in 1 ml, there is 4 milligrams. So what is the plasma glucose concentration? 4 milligrams in every ml. Now tell me how much glucose is getting filtered. How much is the filtered load of the glucose? The filtered load of the glucose is GFR, that is 125 into the plasma glucose concentration is 4 in every ml. So in this 125 ml, how much glucose is there? 125 into 4, because in every ml there is 4 milligrams. 125 into 4, how much? 500 milligrams per deciliter. So this much amount of glucose is getting filtered every minute. Okay, this much amount of glucose is getting filtered. Now out of this 500 milligrams, how much is the maximum capacity that you can reabsorb? How much is your maximum capacity of the reabsorption? Sir, your maximum capacity of reabsorption is always 375 milligrams. Is that maximum you can reabsorb? So you tell me, out of the 500 milligrams that is getting filtered, the maximum you can reabsorb is 375. So how much will be lost? 125 milligrams of glucose will be lost per minute. So this much amount of glucose is getting lost every minute. So this is how the questions will show up in your exam. Okay, now you understand? So now tell me, when the glucose will be appearing in the urine for the first time, when your plasma glucose is 200. How much is the maximum capacity of the glucose reabsorption? The maximum capacity of the glucose reabsorption is 375. That's called as the transport maximum. Okay, done. Now if you understand this, let me show you the glucose titration curve. Guys, here I am showing you the glucose titration curve and the transport maximum. First of all, look on the x-axis. I am talking about the plasma glucose value. Like how much is there? 100, 200, 300, 400, something like that. Okay. Now here I am showing you 3 curves. One is A, B, C. Let's say 3 curves are there. 1, 2, 3 you can say. Now what is this green color curve representing? Green color curve is what, sir? See, it's like a straight line directly proportional. So what is this green color curve? Let me tell you. Students, I am asking you, you tell me. Here, this is the glomerular capillary. Let's say here is the glomerular capillary. Down here, what is this Bowman's capsule? Now I am keeping 100 molecules of glucose, let's say here. For an example purpose, I am keeping 100 molecules of glucose. Tell me, glucose is freely filtered substance, yes or no? Freely filtered, sir. Glucose is freely filtered. You keep 100 molecules. How many molecules of glucose will be filtered? 100 will be filtered. You keep here 1000 molecules of glucose will be filtered. You keep 10,000 molecules of glucose will be filtered. So more the plasma glucose, more will be the filtration. More the plasma glucose, more will be the filtered load. Simple logic, no? You keep more number of molecules are filtered. You keep less number of molecules is filtered. So the first curve, see this green color curve is the glucose filtration curve. You can see here in the green color glucose filtration curve at glucose filtration rate. If the plasma glucose, if 200 molecules are there, how many will be filtered? Same 200 will be filtered. If you have 800 molecules, same 800 molecules will be filtered. So more the plasma glucose, more will be the filtered rate. Directly proportional. Okay. Now yes, this green color curve is the filtration curve. Try to understand. The green color curve is the filtration curve. Fine. Next, what about this orange color curve? See this orange color curve. See, initially, whatever is getting filtered, the green color curve represents what? Filtration, filtered glucose. Whatever is getting filtered, that is getting reabsorbed in the beginning. See, reabsorption increases. But at 200, see, when the plasma glucose is at 200, whatever is getting filtered, try to understand, whatever is getting filtered, now is it getting reabsorbed? No, now for the first time the curves are splitting. Why? Because I have taught you, when the plasma glucose is reaching 200, some glucose, because of the weak nephron, some glucose is getting lost. So whatever is getting filtered, is that getting reabsorbed? No. So this curve which I am showing in the orange color, this is the glucose reabsorption curve. But tell me, in the beginning, reabsorption increases. But once you get a value of 375, okay, reabsorption value, once you get a value of 375, Will any glucose be further reabsorbed? No. See, still filtration is happening. Filtration is continuously increasing. Whatever is there, if you increase the plasma glucose, automatically filtration is increasing. But reabsorption, maximum capacity of the reabsorption is 375 milligrams per minute. So after that, any further reabsorption is happening? Any further reabsorption is there? No, there is no further reabsorption. Reabsorption stops. It's like a flat line. The maximum capacity always 375, beyond which it cannot increase. So now tell me, this orange color curve is what? This is the reabsorption curve. Reabsorption curve. So what is the difference? See, what is the difference between this green and orange? What is the difference coming? The difference is the loss of glucose in the urine. So whatever is getting filtered, that is not getting reabsorbed. So what is this area? That area is called as a splay. What does splay mean? Splay means the amount of glucose, the difference in the filtration and the difference in the reabsorption. So that is because of the weak nephrons. Some nephrons are leaking, right? So this is called as a splay area, and splay represents what? It represents the amount of glucose that is getting excreted. Done? Now, what is this blue color curve representing? See, the blue color curve is starting from which area? The blue color curve is starting from this point, guys, when the plasma glucose is 200. When the plasma glucose is 200. So tell me, who is starting? When the plasma glucose is 200, the urinary excretion of the glucose is going to begin. So exactly in this area, the urinary excretion is beginning. So yes, the urinary excretion of the glucose is going to begin. Okay. So this blue color curve is the glucose excretion curve. So first one is the glucose filtration curve. It's like a straight line. Whatever is there that is getting filtered, it's like a straight line. And the orange color curve is stopping at 375. So this is the reabsorption curve. And this blue color curve is the excretion curve. Okay, excretion curve. It's beginning from 200. So with this, successfully what we have completed, the titration curves, glucose titration curve. In your exam, what they will ask you, what is this green color, blue color and orange color curves? One is filtration, reabsorption and excretion curves. Excretion begins at 200, reabsorption stops at 375 milligrams per minute. Okay, so with this, the glucose topic completed. Hope the video is helpful. Thank you.